In all honesty, as a little boy, I wanted to become an Air Force pilot. My father was an Air Force pilot, and that's something that I always looked up to. But as I grew and saw different things, I ended up actually going into medicine. It was either a brain surgeon or Air Force pilot. I think I chose one. I really started my education in Atlanta, Georgia. I was a neuroscience and behavioral biology major at Emory University for my undergrad. Then I attended Medical College of Georgia for my doctorate, and that's really where another point where my peak for neurosurgery happened. I really started enjoying seeing pediatric neurosurgery. I continued that in a residency program here at University of South Florida. I completed a neurosurgery residency at University of South Florida. I also completed I was a clinical fellow at the A.I. DuPont Pediatric Hospital for deformed children, where I did special training in pediatric deformity. Bringing all that back together, I really specialize in spinal deformity and complex spine surgery down here in Florida. Neurosurgery is a complex field. The best part of it for me, honestly, is the satisfaction you get and the patient interaction that you have. I think in the field of neurosurgery, you have a very unique patient interaction. You see the patients at the worst part of their life, sometimes at the end of their life. And a lot of times you see the patients during elective surgery, which is in the middle of their life. And looking at the whole gambit of the situation, I think the best part of my job is really the patient interaction. My philosophy of patient care is really what we call, or what I call, my office calls, patient-centered care. We take the whole patient, and that's a philosophy that medicine has adopted over the last 10 years to involve the patient in the decision-making of medicine. And that's important. I think that the patient should have a right and should have a say in how much risk they take and how much care they need to have. And a portion of that is education. So we really focus on patient education prior to decision making. So we spend quite a bit of time educating the patient on their pathology and then describing the options and why each option and risk with each one, so that they're an integral part of that decision making. Patients absolutely have a choice when they get referred to a neurosurgeon, particularly spine surgeons, because orthopedic surgeons do spine surgery, neurosurgeons do spine surgery, as well as brain surgery. My recommendation to even my own patients when I give lectures across the city is always get a second opinion. Your physicians have a referral base, which may be small or large, but there may be other physicians out there that may have a better philosophy of patient care that better interacts with what you're comfortable with. So even if I'm seeing a patient for the first time, I always give them the option of a second opinion, because I want them to be comfortable with their decision. I think what makes the patient comfortable in our practice particularly is that patient education. We really do spend a lot of time educating the patient, and a lot of times the patients are very thankful that they learned about their pathologies. And surprisingly, a lot of them sometimes decide to be less invasive or take less risk because they understand the pathology more. They'll realize that this tumor is very slow growing and that maybe surgery is not the best option. And I always give them that option as well. So I think the patient education is what's important.